I was in my 30s when I was diagnosed with stage 3 colorectal cancer. For my first surgery, when I came in, I was very nervous, but the doctors, nurses, everyone just put all my fears to rest, and I'm going home. I just want to say a big thank you to Dr. Atif Alvi and the incredible team at King's. I'm Maheen Meenai. I'm from Pakistan. I was in my 30s when I was diagnosed with stage 3 colorectal cancer. And while the diagnosis was traumatic, it was very important for me to look into treatment options. Started back home in Pakistan. I got my radiation done, had to go through chemotherapy. Once I was done with all of that, surgery was the next option because I had to get my tumor resected. And that was the challenging bit because my tumor was low-lying, and the surgical options that I was being offered back home were very invasive. They would affect my quality of life significantly. So that's where I started looking outside of Pakistan. Dr. Atif Alvi's name kept coming up in conversations with people I knew. So I started researching and found out that King's College Hospital was state-of-the-art. Dr. Alvi's qualifications were amazing. So I got on a call with him over Zoom, where he went over all of my reports, and he was very confident. If I were to come here, he could do a keyhole procedure for me. So that's when I came to Dubai. So I had to have 2 surgeries. For the first one, we had to resect the tumor, and I had to have an ileostomy. For my first surgery, when I came in, I was very nervous, but the doctors, nurses, everyone just put all my fears to rest. It was such an amazing team. Post-surgery, things were painful, but because everyone was so hands-on in managing the pain, figuring out how to normalize everything from my blood pressure to my heart rate. Everything went absolutely seamless. I was able to go home in 6 days, which was incredible because I had no idea that after such a major surgery, I could go home so soon.
My name is Atif Alvi. I'm a laparoscopic colorectal and general surgeon at King's College Hospital, Dubai. Maheen is a young patient who was diagnosed with low rectal cancer in Pakistan. She was offered treatment in Pakistan, which was open surgery. Most places do not offer sphincter preserving surgery, which means that they remove the whole tumor and patient ends up in a permanent colostomy bag. I have a special technique to do ultra-low resections where a patient have a normal bowel function without having a bag. The results of the surgery showed a completely cured, removed cancer, which is fantastic news.
Post-surgery, kept coming back for follow-up appointments. Again, everyone was hands-on. Dr. Atif Alvi was absolutely amazing, kept checking in on me to ensure that things were going okay and my healing was fine. 5 weeks post my first surgery, I was able to have my second procedure with him, which again was a complicated procedure, but the way he managed it, again, with full confidence, and I'm going home. I just want to say a big thank you to Dr. Atif Alvi and the incredible team at King's. Like I said, they have been wonderful throughout this entire process. Getting news that you have a disease like cancer, it's very traumatic, but I've realized if you have the right team with you, you can get through everything and it becomes all that much easier. The one thing that I do want to stress on is that I was diagnosed with colorectal cancer when I was in my 30s, and this is something that people don't get screened for till they're in their 40s. So I would really encourage everyone to go and get tested. If you start getting any symptoms, do not ignore them. Don't think you're ever too young for these things to happen. They can happen. Cancer is not a death sentence. If caught early, it's completely curable. So I would really encourage everyone to go and get tested.
I would like to emphasize a point of bowel screening program, which we have implemented in UAE, patients who are 40 and above. But considering the age of Maheen, she's under 40, this is slightly worrying for a whole population. Therefore, I encourage people to be aware of their bowel habits and get themselves checked even if they're young age, even if they're less than 40. Any change in bowel habits or rectal bleeding, they must get it checked. Don't take it easy, as early detection of cancer means cure from the disease. Maheen is also the first patient in the United Arab Emirates to take part in the genomic sequence study, which we are conducting in Dubai at present. This is the first of its kind of study in this country. We have selected 10 patients with colorectal cancer. We take part of the tumor specimen and part of their saliva and perform studies. This study will give a detailed information about the genetic sequence, which will help in treat cancers in more precision, and it will be useful for their families to know what sort of gene they carry.